Hello and welcome to The Virus. I'm Norman Swan. Tens of thousands of cases of COVID are being recorded each day across Australia. Coming up, we look at how cases are spreading in schools and what can be done about it. Plus, how will we react if restrictions are reintroduced? Will we rebel or will we adapt? It's not just Australia that's experienced a recent surge. Europe and parts of Asia have also seen a rise in cases, and it appears to be due to the BA.2 version of Omicron. So what is the BA.2 coronavirus? BA.1 is the Omicron which swamped Australia over summer. BA.2 is its stealthier sister. BA.2 is likely to have emerged from the same parent a little later than BA.1, but it has steadily pushed it out of the way around the world and now in Australia. The reason is that BA.2 spreads more easily. But the question is why? Is it because it evades the immune system or that it's a more contagious virus? A study published 2 days ago suggests that while BA.2 is more antibody resistant, it does seem to be more contagious in its own right. Then there's severity. BA.2 seems to be just as severe as BA.1. And remember, this is the worst year of the pandemic in Australia, with a similar number of people dying each day as did in the entire period of the recent floods. BA.2 is currently devastating Hong Kong, causing deaths in as many as 1 in 200 people with COVID-19. That's one of the world's highest death rates from COVID-19. And joining me now is Bloomberg medical reporter Michelle Cortez from Hong Kong. Welcome, Michelle.
Thank you.
So what's going on? Why has this occurred?
The virus did get through Hong Kong's COVID-0 barriers, and it got into nursing homes and the elderly population. And from there, it was game over. The elderly weren't fully vaccinated, so the spread of the virus continued apace, and the deaths have fallen on to that. When you look at the number of people who have died at younger ages, it's not anywhere near as bad, but when you're looking at that most vulnerable elderly population, it's really devastating.
Why did that happen?
Early in the outbreak, I think that it was a point of trying to protect the elderly. Remember, the vaccinations were developed incredibly quickly, faster than any vaccine has ever been developed in the entire world. And so in Hong Kong, rather than trying to protect the elderly immediately for fear of the virus itself, in Hong Kong, the virus wasn't circulating. So they said, let's hold up just a minute and make sure that the vaccine is safe so that we're not doing any damage. That early message, raising the possibility that there might be something wrong with the vaccine, really just lasted here. And many people didn't want their elderly family members vaccinated, and many of the elderly were afraid themselves. Turning the tide on that, changing those perceptions from early on, has been incredibly difficult.
So what are the chances that Hong Kong can turn this around?
Well, you can never really count them out. You see what's happened again and again in China, where they have taken outbreaks and gotten back to zero. It's important to note that they haven't done that in the Omicron era, of course. And also China has been much more aggressive in locking entire places down. Whereas here in Hong Kong, we still do have restaurants open, shopping malls are open. So there is still quite a number of people who are out and about, and the virus is circulating. The chances of getting back to zero honestly are probably pretty close to zero, but in terms of getting the outbreak under control to a more manageable level, that's something that likely will happen, because at this point the government is fully committed to that, and they're going to do whatever they can to get back close to that, controlled level.
Michelle Cortez, thanks very much for joining us on The Virus. We were warned to expect an increase in cases once students return to classrooms, and it's happening, with the school age group dominating COVID cases around the country. Dr. Archana Korala is a paediatric infectious disease specialist at the Children's Hospital Westmead. Welcome, Archana.
Thanks, Norman.
So how is this spreading in schools? What's the story?
Yeah, sure. Well, I would say that they're spreading across school-age children, not just within schools. And really, it's mainly because there's community circulation of the virus. And we know that when there is circulation in the community, school-age children are part of that community, part of the household, and it infects them as well. Within school settings, we are seeing a lot more introductions than we've ever seen before. And again, that's reflective of the transmission within the community. We also know that to maximise education, we're not isolating the school contacts, and so there is a potential for increased spread.
I mean, you're hearing of whole classrooms being infected. Is that simply from importing the disease into the classroom rather than spread within the classroom?
I think it's a combination of both. So once you have quite high circulation in the community, you have quite high numbers of children bringing it in at the same time, which again, if one child transmits to another, then there's that kind of exponential increase.
We covered the story of children a couple of weeks ago on the virus, and Professor John Skerritt from the TGA was saying we've been misled that this is a mild disease in children. He's saying there are 6 children have died, and we've just been too complacent about children. Do you agree?
Look, I think the vast majority of children to date have a very mild illness. And I think that needs to be balanced with the risk of other issues with children that have occurred during the pandemic, such as mitigating face-to-face education, mental illness, being very isolated. We know that there will be variants, and there will be increasingly transmissible variants, and we need to measure the effect on children, the effect on transmission, to the other indirect effects of COVID-19. So yes, in summary, there a few children will be affected with COVID-19, will require hospitalization, and these can be mitigated with vaccination.
And yet we have relatively low vaccination rates for children, particularly in the 5 to 12 age group.
Yeah, no, that's right. It has stagnated in Australia. And I think that's, I guess, the perception that, children have a very mild illness. And so there isn't that kind of drive to go and get your child vaccinated. But a recent study that's published in the US by the CDC, the PROTECT study, showed that although it wasn't, the vaccine didn't prevent infections in Omicron the same way that it did with Delta and previous variants in the ancestral strain, it still has an effect. And even in children aged 5 to 11 years old, there was a 30% decrease in infection rates in vaccinated children.
And just remind us of the safety data.
Yeah, sure. So Australia has very robust safety data on the vaccination of children. There's a national surveillance program, AusVac Safety, and it's recently released some results, and it showed that children tend to have much milder adverse events following the immunizations. They tend to have less fever, less local reactions compared to the adult population. And reassuringly, compared to the adolescent population, there hasn't been any signal of an increased effect of myocarditis or heart inflammation in this age group.
Inflammation of the heart. And finally, one of the reasons why people fail to get immunized is convenience. Why aren't we doing this in schools like we did with human papillomavirus and we've done with other viruses? Why aren't we sending nurses into schools to do mass immunization in schools? Most parents would be quite grateful.
I think it's because this now, if you think about the immunization program, this is in primary school settings. It's different to the human papillomavirus where the vaccination occurs in a secondary school setting. For the effective vaccination of children, you really need to make it an environment where they're not anxious, they're with their parents, and it's a safe environment for children. And I don't think a primary school environment without parents being there is very an environment that children feel safe getting vaccinated. But, there are lots of GP practices that are open after hours on the weekend that can vaccinate your child.
Arshana, thank you very much for joining us on the virus.
Thank you very much, Dr. Swan.
For many people, life has returned to relative normality, with lockdowns over, no QR codes, although there is still some confusion around masks. Predictions about how bad the epidemic will be in the future emphasise that a key variable will be how willing we all are to go back to mandatory mask wearing and tighter restrictions around high-risk environments. Dr. Liz Allen is a demographer at the Australian National University with an expertise in population health. Hi, Liz, and welcome to the virus. So, how do you see this going, considering that there are going to be new variants, and the new variants will be more contagious, and they could be more severe?
Yeah, if we looked at data concerning the way the population has viewed government and so on, we can learn quite a bit about perhaps, I guess, the beginning of a bit of fatigue. And if we look around the shops and our local community, we can certainly see that fatigue when it comes to mask wearing. If we look at the data which relates to trust in government and how people view leadership and so on, there's a worrying trend that I think there will be difficulty moving forward if the messaging from government isn't done right. And of course, we need the entire population to be on board to have any real effect at really protecting us in the long run. And I think we're on a bit of a precipice at the moment now where we really need to see leadership from government and from wider community organisations to get people interested and committed and engaged to fighting this virus.
So speaking of messaging, is the rhetoric that we're hearing from state and federal governments that the pandemic is over, that's presumably not helping?
It's incredibly harmful because it's not over. And if we look at data, particularly around people that worked from home during the peak of lockdown and so on, most people can't work from home. And so I guess I'm concerned about the potential on livelihoods and well-being if this messaging isn't done right and if there isn't sufficient support put in place for people who are going to be hit the hardest. And we seem to have lost all supports for people who are in precarious employment, and the pressure for people to go to work and to be infected and then to spread the virus is a major risk factor.
So what is the right messaging?
We need to see a coherent message on that unifies Australians and unifies Australians with regard to why we need to be protecting everybody. And everybody, yes, we're all in this together, but there is support. We need to see the rhetoric backed up by actual support and supports that are meaningful and lasting by way of financial support and other supports for emotional well-being and so on.
So do you think we'll see a return to the quite aggressive demonstrations against restrictions?
It's unlikely Australians will take to the streets and rebel in enormous numbers like other countries might, but I think they're more likely to rebel in quiet ways. And those quiet ways are the ways I guess we've got to be more cautious about, because it would be happening behind closed doors or happening in the streets in ways that will help spread the virus. So we've got to get the messaging right.
So does the messaging that you mentioned earlier, is that the strategy for moving forward, even with the people who are in quiet opposition, such as you say?
Most definitely. And I think we've got to be careful not to go too hard about a so-called war that we're waging, but we also need to be firm enough that people realise the consequences for everyday Australians, and in particular people who are vulnerable and who are really missing out on life as a result of us getting this virus handling wrong.
I mean, part of the problem here is uncertainty, isn't it? We just don't know what the next variant is going to look like. All we know is that it will be more contagious.
Indeed, uncertainty sparks fear and makes us behave in all sorts of ways that perhaps we wouldn't have thought otherwise. You know, we rush out and panic buy and things like that. These are normal responses to something like uncertainty. But of course, that has real problem. When we have fear and uncertainty, we behave in ways that is not necessarily for the good. And there's a saying when it comes to research that perception is more powerful than reality. And I think at the moment people are not looking to the figures when it comes to the statistics on the virus and how it's spreading, because the numbers are quite large. And we don't seem to have worry. We seem to be very complacent generally among the community. So if we think about perception is more powerful than reality, we need to have that messaging that really goes to the heart of we are all in this together, and we need to stay in this a little bit longer to ensure that we can get to the end and emerge stronger.
Liz Allen, thank you very much for joining us.
Thank you.
Well, that's the show for this week. Remember, don't be complacent. And thanks for your company. See you next time.